what we've been witnessing is that there's not just one humanitarian crisis that's taking place in these three countries, but two. And the other is related to the non-Ebola related deaths from the various other diseases that people are struggling with in these countries.
As the Ebola virus continues to ravage West Africa, those suffering from other diseases like tuberculosis and malaria are now facing death as previously under-equipped health systems failed to cope with the scale of the crisis. As hospitals in the affected areas teeter on the brink of collapse, many people with diseases that can be treated are dying because they are unable to access medical help.
The health system itself is collapsing. Nurses are scared to go to work, and this is more in the government sector. So your local clinic is maybe not there, you aren't getting your malaria tablets, so you're waiting for a long time until you actually need transfusion and IV medication. So it's very hard to operate one hospital in a collapsing health system. People are terrified of getting Ebola.
This is the worst outbreak in history of Ebola, a deadly hemorrhagic fever that is killing more than half of its victims, for which there is no proven cure. In the 7 months since the start of the current outbreak, members of the international community have yet to implement measures to effectively stop the disease in its tracks. According to the World Health Organization, an estimated $1 billion will be needed.
And so the spread of Ebola continues unabated as the response fails to curtail and bring down new infections. And MSF is really angry that the world and the international community is failing the people of Sierra Leone, Guinea and Liberia.
At a press briefing in Johannesburg, MSF urged South Africans to donate so that its 3,000-strong team can continue relief operations in West Africa. I'm Juli Switala reporting for Business Day and Financial Mail.